Welcome to Beyond the Wheeze, the podcast where perseverance meets potential. I'm Josh Rheaume, public speaker, marathon runner, asthma advocate, and your host as we explore the intersection of health, fitness, and resilience. Whether you're managing asthma, chasing a new personal best, or simply looking for inspiration, Beyond the Wheeze is here to show you that no challenge is too great to overcome. Together, we'll uncover stories, insights, and strategies to help you push beyond your limits. It's time to breathe deeply, move forward, and unlock your true potential, one step at a time. Asthma is more than just a condition, a daily challenge that affects millions of Canadians. Behind the scenes, dedicated leaders are working tirelessly to improve care, drive awareness, and push for better policies. One of those leaders is my guest today, Jeff Beach, the CEO of Asthma Canada. Jeff is a passionate force in the Canadian nonprofit sector with over 25 years of experience in management, patient advocacy, community engagement, and fund development. He's dedicated his career to helping others overcome health and social challenges, empowering people to reach their full potential despite the obstacles they face. Before stepping into his role at Asthma Canada, Jeff held leadership positions at organizations like Cystic Fibrosis Canada, the Arthritis Society, and the Canadian National Institute for the Blind. He's also deeply involved in charitable and advocacy work, serving on multiple boards and advisory councils, all with the goal of improving lives. Today, we'll dive into the state of asthma care in Canada, the challenges that still exist, and how Asthma Canada is working to create a future where no one has to struggle needlessly with this disease. If you're an asthma patient, caregiver, or advocate, this is a conversation you won't want to miss. So Jeff, with that being said, welcome to Beyond the Wheeze.
Thanks, Josh. It's a pleasure to be here.
I will say off the hop, I am having some breathing difficulties myself today. So if I sound a little bit out of breath, if I need to take this little guy here, it's part of the game. I didn't sign up for it, but
that's the reality.
Again, thanks, Jeff. We have worked together in the past in regards to asthma advocacy. I would say you were probably the one that really got me involved in what I'm doing today. I don't think I would be doing this podcast if it wasn't for you and for Asthma Canada and for the advocacy efforts that you showed me that I am capable of doing, which in a million years, I never would have thought possible from my end. But just knowing that I make such an impact, that I have the potential to make an impact has really been huge. You are a big inspiration for me as well, Jeff. So again, I really do appreciate having you here.
Thanks, Josh. Appreciate that. And I have to say it's a privilege working with you, and you sharing your story is an important part of what I think we'll talk about today, is why that's so important and why we need more people like you to step up and share stories and show people the reality of what it's like to live with a disease like asthma and how you can work hard to overcome those challenges.
Absolutely. That's it, right? Being around it for my entire life, being around the advocacy effort in more recent years, say 4 years or so, I've recognized that there is a gap and that I am able to somewhat fill that gap. But as you said, we could always have more advocates. I think the healthcare industry needs it. I think we hear a lot from doctors, caregivers, specialists, but we don't really hear a lot from the families and the patients and what that struggle looks like internally. So I do hope that we see more of it, especially with social media today. We can have more impact than we think we can.
Absolutely.
So Jeff, I've had the privilege of working with Asthma Canada, and I've seen firsthand the incredible impact that you and your team have had. What inspired you to take on the role as CEO of Asthma Canada?
So for me, I was actually working with another organization at the time that I was alerted to the fact that Asthma Canada was recruiting a new CEO. The longtime CEO of the organization had left and moved on to another position. So the board hired a firm to do some recruitment. I was recommended by someone, a former colleague, who thought that it might be a good fit for me. The recruiter reached out to me, and I thought, why not listen to what they have to say? And once I learned a bit more, having been in the health charity space, I knew a bit about Asthma Canada, but wasn't overly familiar with the work of the organization. But once I really got to know the organization, the board members that were involved in the peer review process, it became apparent to me fairly quickly that this would be a good fit for me, and it was something that I really wanted to pursue. So I guess it was a question of my experience of what they were looking for really matched well. And as someone who I was diagnosed with asthma over 25 years ago. So I haven't had the same level of challenges that you have with the disease, but certainly can understand and appreciate the importance of asthma management, proper diagnosis, and so forth. So it was a great chance for me to move to an organization and a position where I felt like I could really have a tremendous impact for the people across Canada.
What drew you to this kind of working with these organizations?
So initially, it wasn't what I set out to do with my life. I didn't, I didn't emerge from school saying, I really want to be the executive director or the CEO of a nonprofit health organization. It was more of an evolutionary process. So my original career path that I wanted to be on was to becoming a psychologist. I wanted to be either a clinical psychologist or a research psychologist. And what I started to do while I was still in school was look for opportunities to work with people who were experiencing health and social challenges. So that was what led me to my initial positions, which were working with blind, multi disability, and blind and visually impaired children and youth originally. And that gave me some exposure and really, I think, ignited the passion for me in terms of what this sector is all about and what working in this sector is about. So it was from there, I just sort of gradually moved into different positions, social service type organizations and health charities. And here we are, X number of years later. But my original draw was because I really wanted to work with people and I really wanted to understand how I, in my, whatever that role might have evolved to, could make a difference in people's lives. And that's, I always figure if you can find a way to marry your passion with making a living, how much better can it be than that?
Leading a national organization comes with big challenges. There's no doubt about that. What are the most rewarding parts of the job?
Well, I think for me, it's really, it goes back to that intrinsic passion and, wanting to make a difference in the lives of people. And I think regardless of what your role is in the nonprofit sector, if you're someone like myself who's leading an organization, working directly with a board of directors, if you're somebody who's working in a more administrative role, maybe a finance role, something kind of like a back office type position, I still think that the big motivator for people needs to be that mission that we're working on. So in our case with Asthma Canada, we're here to help people with asthma across the country live better lives, essentially. And, we'll talk a little bit more about what those mission priorities are for us later, I'm sure, but it really all comes down to that. So I think when you look at challenges, funding is always a challenge for us in the nonprofit sector in general, certainly with health charities. But for me, the most rewarding part is kind of putting it together and figuring out how we can do things that will make a difference. I often say sometimes in my job, even when I have a really bad day for whatever reason, I can still go home at night, or if I'm working from home, go upstairs with my family and know that I've done something that is helping others. And so that is really what keeps me going and is truly the most rewarding part of my job, is that every day I'm not working hard to make shareholders money or anything like that. It's really to help people who are experiencing health and social challenges. And that's what's kept me passionate throughout my career.
From your perspective, Jeff, what are the biggest challenges asthma patients face today in Canada?
Well, I think, asthma is obviously a very prevalent disease. There are over 4.6 million people who across the country who have been diagnosed with asthma. There probably are more asthma patients that are living with this disease, that especially milder forms of asthma, who may not even be diagnosed. That number is probably larger than what it is, what we're reporting rather. But the biggest challenges are around access to proper diagnosis and healthcare resources, and sometimes medication as well. We're very fortunate to live in a time where there are incredible medications available to people living with asthma and other inflammatory diseases, like biologic medications that for people with severe asthma that was considered to be basically untreatable or very, very difficult to treat. They're seeing medications that are available today making a huge impact on their lives, life-changing impacts. But it comes down to the biggest challenges would be the fact that a lot of people with asthma are not diagnosed properly. They're not given the proper education in terms of how to manage their disease, because medication is only one part. As anyone that knows your story will attest to. Sure, yes, you do use your medication and rely on that, but you've also done a lot around your life around avoiding triggers and improving your lung health in general. That's made a big difference. So the biggest challenges are, helping people understand that. And asthma tends to be a disease that kind of gets lost sometimes in that process. And we want to make sure that we make noise around it so that that doesn't happen, so that people know what's available to them and how they can manage their condition.
Absolutely. It's evolving every day. When I was young, 14, 15 years old, biologics became a thing. I mean, to some extent, Xolair was coming out, but the price of a needle, unfortunately, was sitting at about $2,000, and needing that every couple of weeks just didn't really sit in the budget for my family. And unfortunately, insurance at that time wouldn't cover it. It was too new in Canada, at least on the East Coast in Nova Scotia, where I was from. One of my passions is bridging the gaps in respiratory care, from early diagnosis to access to specialists. Where do you see the biggest gaps, and what is Asthma Canada doing to address them?
So there are definitely some big gaps in care. And I think, to go back to the previous question, looking at diagnosis of asthma, treatment, and ongoing care and management of the disease, there are gaps in each of those major points in anyone's life as a patient. So making sure that we have access to proper diagnostics, proper resources. For example, spirometry is usually how asthma is diagnosed. There are other testing methods as well, but for most patients, that initial diagnosis comes through spirometry testing, and spirometry equipment, qualified testing individuals. We just don't have enough. And health human resources in general are a big challenge for people in Canada. A lot of people are living with the benefit of having a family physician or a GP or a family health team. So this just really exacerbates the whole situation. But I would say the biggest gaps would be within the healthcare system itself. And then beyond that, it's really the patient education piece that just tends to get lost in the shuffle for a lot of patients. And as I said, we want to make sure that we can change the narrative.
Absolutely. And you're familiar with my story. I've been at workshops. I've attended workshops facilitated by Asthma Canada. You've seen me at various speeches around Ontario. And for the people listening to this podcast, well, my story really started when I was a baby. I was diagnosed with severe asthma at a young age. And I really suffered. My family suffered as well. It wasn't just me, up until I left at around the age of 18. And I took myself away from those triggers that, unfortunately, I just didn't have the proper education. Had I had the proper education, or even my mom, a single mom of 4 kids, had she had the proper education, we would have been out of that house built in 1867 full of dust mites. We wouldn't have had farm animals living in the house. We wouldn't have had dogs, cats. Do you know what I mean? We really would have changed how we were living. Seeing my 2 girls now, I have twin girls just over the age of 2, and they're both on inhalers already. And you bet your ass that I would move away. I would move mountains for those girls if it meant that they had a better chance at breathing. Unfortunately, that education wasn't there. So my story of change really did start when I was 18. However, I didn't really start honing in on how effective non-medicinal aspects of asthma management could be until I was about 30 years old. And that's when I discovered running, and I discovered how being better at one thing, so conditioning my lungs, made me able to be around other triggers a lot more effectively. We know that asthma management has come a long way, but there's still work to do. What advancements or policy changes do you think could make the most significant impact?
Well, I think, Josh, your story really illustrates the point that we're trying to make in the advocacy work that we're doing, and policy changes that we know would make a difference for people. As when you talk about the fact that you were unknowingly, and your family was unknowingly exposing you to triggers that were just making your asthma worse and exacerbating the condition. That's the case for a lot of people. Just don't realize sometimes how big of a difference asthma management can make. So the biggest change is to make sure that people are diagnosed as quickly as possible. If they need to see a specialist, to be able to do that as soon as possible. Those referral pathways are not very well established especially in areas that are more rural and remote, where access to healthcare is deplorable, but specialist care is even worse. And making sure that there are opportunities for education, for respiratory education through certified respiratory educators at different levels within the system. So just imagine if your mom would have had certified respiratory educator to work with when you were a kid, who could have taught her about how to better manage triggers, to understand. And it's very much an individualized thing as well, as no two people with asthma are exactly the same. There are common triggers that affect most people that live with asthma, but no one's situation is exactly the same. So it's not just about the medication and availability, which is really important. And that's part of the constant policy agenda for us, is making sure that people have access to, and public access, and through private insurance in some cases as well, to life-changing drugs that are available. But it's also about putting pieces in place within the healthcare system and make sure that people don't fall through the cracks. We see every year that asthma is one of the number one reasons why people, especially children, present to emergency rooms. All you hear about is how emergency rooms are overcrowded. Sometimes the emergency rooms in some rural hospitals have to be closed down at night because they just don't have the staff to manage them. If we can divert people with asthma from having to go to seek emergency care, because we're providing the diagnosis and the education and the treatment they need earlier in the, downstream or upstream, I always get confused about that, it would make a huge difference. And yes, there are still going to be times where people are having exacerbations, severe asthma attacks, where they need to be rushed to emergency, but we can greatly reduce that if we have some of those other pieces of the system working better and working for patients.
Yeah, and that's actually something that I talk about. Is I would be in the hospital for a week, 2 weeks at a time, whatever it was, just to be discharged and sent back home. And I'd be fine for a day or two, but then it would start getting bad again and bad again and bad again. And needless to say, if I wasn't in the hospital, I probably should have been. It was certainly a better place for me. And it created that revolving door for the emergency ward. And it certainly didn't need to be there. Proper care, proper management, proper education really could have helped. It would have been certainly a lot less taxing on the healthcare industry, for sure.
Yeah, I mean, there's an economic cost. We talk often about the cost to patients who are not able to realize their potential and manage their disease well because they're not properly diagnosed, or they haven't received the care or the medication or the education around how they can manage their disease better. But there's also a dollar cost to the healthcare system for this. And as much as, we like to put our healthcare system on a pedestal, there are gaps and there are ways to improve it. And one of the ways that we can do that is by looking at it through more of a preventative lens. So emergency care, having people hospitalized, is the most expensive part of our healthcare system. So if we can invest in some of those educator resources and really setting people up for success from the moment of diagnosis at the primary care or specialist care level, if they're there, they won't be as much of a burden, if you want to call it that, on the system at that end, where people are hospitalized. And it is, as you said, it's a revolving door for a lot of patients, where especially those that don't have family physicians or family health teams right now, they are using emergency rooms as their walk-in clinics in some cases, in some communities. And we have to find ways to help them before it gets to that point. And when it does, don't put them in a revolving door, put them on a pathway so that they are referred to a specialist, so that they are getting the care and the education that they need to manage their disease.
Get it right the first time, essentially.
Yeah.
Asthma Canada plays a huge role in advocating for better policies and access to care. Can you share some of those key initiatives you're working on right now?
Sure. So we are always looking for ways to contribute from a policy standpoint, from an advocacy standpoint. Our priorities think about Asthma Canada's, one of our roles is being the voice of the patient population. So as I mentioned, there are 4.6+ million people in Canada across all ages who are living with asthma. And we're here to be the voice of the patient. So we interact with patients through patient surveys, through our social media channels, through, depending on the program, sometimes focus groups, things like that, because we want to make sure that the messages that we're bringing forward are in line with what patients value and what they need today, which is not necessarily what they're going to need down the road. So it's always an evolutionary process, but the basic elements don't change too much. One of the priorities is around access to medication and healthcare resources. So if a new drug comes into Canada that is promising, that has gone through clinical trials, that a manufacturer has submitted to and has been approved by Health Canada for use, meaning that it's safe and effective, we advocate, and there's a very complicated drug approval process in Canada, which is getting better. It's the various bodies involved are really trying to streamline it, but it takes a couple of years typically for drugs to be approved. And what we do is we provide that patient voice. There are formal channels through which we can do that as an independent nonprofit charitable organization. So that's one way that, and some of the policy work that we do is really making sure that that process is working. And at the end of the day, that patients and prescribers, their doctors, whoever's prescribing their medication has the ability to and choice to be able to give those prescriptions to people that need them. So that's one big area of advocacy for us. We also do, because Asthma Canada is representing the voice of the patients. We know that one of the major concerns for not just people living with asthma or health conditions, but just the population in general is air quality, climate change, the impact that we know that is climate change is having on our world, certainly in our country here in Canada and the people that live here. So we've advocated for policy changes around clean energy initiatives. Back in 2014, Asthma Canada was one of the groups that came together to try to effect change by, in Ontario, for example, putting us on a path where we weren't reliant on coal-produced electricity. At one time, a lot of Ontario's energy was coal generated, which is coal burning is one of the worst things for the environment. It's a huge pollutant. And I remember I didn't grow up in the Toronto area. I grew up in southwestern Ontario, but I can remember going to cities like Toronto, Detroit, et cetera, where smog days were a regular thing. And a lot of that was because of the coal generated electricity that was happening at that time. That's not the case anymore in Ontario. I realize there are parts of the system that still rely on it, but we're moving towards that path of decarbonizing the grid. And that's part of the policy change that we continue to advocate for, because at the end of the day, it's, we're not trying to take sides in politics or anything along those lines, but clean air means people are better. Asthma patients are better if they have clean air to breathe. So we're advocating for that. We also advocate for indoor air quality initiatives. So making sure that, building codes are up to standard. We work with a National Lung Health Alliance with a lot of the other lung health organizations that are looking at things that are directly related to asthma, for example, like radon testing and making sure that's available because it is a contributor to lung health and lung cancer. Making sure that people are aware of what's available to them in terms of air purifiers and what perhaps government might be able to do to provide tax incentives especially for people who are from low income families and communities where they should have access to those types of tools as well to be able to at least ensure that the air within their homes is clean. And then finally, and a big part of what we're doing right now, focusing on is really looking at health system change that needs to happen. So this goes back to what we were talking about earlier, where we want to make sure that there are CRE, certified respiratory educators, working in the primary care system, giving people the right path off the hopper. So when somebody's diagnosed with, or out of the hopper, somebody's diagnosed with asthma, they immediately are put into this pathway of success where they understand as much as we can possibly teach them about their disease, how they can use their medication properly. A lot of people are using inhalers improperly. A lot of this is more on the preventative scale of the healthcare system. looking at ways that we can improve the environment that we live in, the air that we breathe, but also the healthcare system itself and how we can have better access to those resources. Another thing that we're advocating for is to make sure that chronic disease clinics are available in communities, especially those that have particular challenges around health human resources. It's not acceptable that people who have chronic disease like asthma don't have access to the healthcare resources that they need. And if we invest in some of those solutions, then at the opposite end of the system, we're going to see less people visiting emergency rooms, people living better lives. We talked about the economic costs of asthma on the healthcare system, but there's also an economic cost because of lost productivity, because people aren't able to go in sometimes into careers that they want. We talk a lot about absenteeism, but there's also presenteeism, where maybe somebody is physically showing up at work because they're not feeling well, they're not able to perform in their jobs as well as they should be. So there's a lot of those costs that are kind of hidden as well. And it all goes back to asthma management, proper diagnosis, proper treatment, being on the medications that you should be, and then looking at how you can develop an asthma action plan to manage your care better. And those are the areas that we really focus on from an advocacy perspective and some of the policy change that we'd like to see happen.
Many people still underestimate asthma as just a minor condition. How do we change that perception to get people to take it more seriously?
Unless you actually live with asthma, you don't realize the type of impact that it can actually have beyond the occasional shortness of breath. And so people think you're diagnosed with asthma, they give you an inhaled medication of some sort, send you on your way, and you're good to go. You don't ever have to think about it again. And that's the furthest thing from the truth. Asthma is a serious disease. A lot of people don't realize that asthma can be fatal. There are several hundred people, usually around 300 people annually across Canada, who die directly because of asthma exacerbations, asthma attacks. Unfortunately, some of those are children. We work with families who have shared heart-wrenching stories about children who are 8 years old, 14 years old, young adults with their lives ahead of them who suddenly are gone because they suffered a fatal asthma attack. So it does happen. The good news, though, is that for the majority of people, if asthma is properly diagnosed and treated, and if people are taking it seriously as it should be, asthma does not have to be a fatal disease. And so that's one of the markers that, we put forward. We look to the future as we want to get to a point where we're not talking about asthma deaths in Canada. We're talking about people managing their condition well. So to get back to your immediate question, to me, it's about sharing stories. How can we get people to take it seriously? It's about sharing stories. It's about putting stories out there, both on the hope and inspirational side, like yours, where you have somebody who was really struggling and having a very difficult time, who is now running marathons and doing incredible things with your family and your career. Those are great stories that we want to work with patients like yourself to get out there, but also the difficult ones. I'm meeting someone in a couple weeks, actually in my hometown in Windsor, Ontario, who lost her daughter at the age of 14 last year. And they were just completely blindsided by this. Yes, she had been diagnosed with asthma. She did struggle with the disease, but for the most part, they had no idea that she could be at risk of dying at the age of 14. So we want to get those stories out there because, and I know in the case of this young family that I'm talking about, they want others to hear this story so that hopefully by sharing it, they can help other people realize that asthma is a serious disease. It is something that needs to be taken seriously. It is something that the healthcare system needs to take more seriously as well. We hear stories all the time where patients are just continually renewing the same prescription over and over again without any doctor or pharmacist inquiring or checking it. We have people who are on multiple dose courses of oral corticosteroids, which, yes, are helpful in alleviating severe asthma, but should not be taken in the long term. People should not be on multiple courses of it. There are better options available. So it really comes down again to sharing those stories, getting people to pay attention and getting people to take it seriously. So we've started talking about our role is not just raising awareness about asthma, but it's raising awareness and concern about asthma because we want people to pay attention and to really take it seriously.
And for those listening who might be asthma patients or families of asthma patients, what role can they play in advocating for better care and policies?
So I think well, one of the most basic roles is to share that story, to come forward and to be willing to share your story. We are constantly appealing to people like yourself who want to share that story. And the motivation for people mostly is to help others, right? To show others what's possible, to show others whether the health outcomes are positive or negative. Sharing all those stories are really important. So that's one of the things. The other is to get involved in advocacy, make your voice known in your community. That could be something as simple as like right now, for example, in Ontario, there's an election, provincial election. We know there's a federal election looming as well this year. It's such an interesting year for politics in Canada and globally, I guess, but there are always opportunities to engage with elected officials or candidates who are running for office to get these messages through to them. So right now we have a key message document that we're sharing with anyone that is willing to send that on to the candidates in their ridings. It can be done through email. It can be something that people can put forward to ask to be put on the agenda for discussions with candidates so that they understand that there are things that they can do as elected officials to make sure that these investments are made in the healthcare system that will ultimately benefit patients at the end of the day. So there's that sort of like simple letter writing type advocacy that can be done. Volunteering for an organization like Asthma Canada, we are always looking for people who are willing to help us with advocacy initiatives. So sharing their story, meeting with elected officials. We're working on a day where hopefully at the end of May-ish this year, we're just waiting for the election to be done before we book the date. We're going to have a Queen's Park Day where we have a reception or a lunch. We're inviting MPPs, the premier, the ministers to come and hear some of these stories. So we need patients to be there to help with those advocacy efforts. And we're doing that not just in Ontario as a big focus right now because of the election, in other provinces as well. Our lung health partners are also doing that sort of advocacy work, and we work together as a strong lung health community to do it. So there's lots of opportunities to make sure that we can advocate together and make lung health part of the agenda when it comes to the policy changes that are being requested.
Yeah, and stories go a long way. So if you're a patient, if you're someone that has struggled with asthma in any way, shape, or form, whether it's gotten better, gotten worse over time, or you're a family member, or if you have multiple people involved in your family that have asthma, if you've seen that side of things, stories go a long way. And I truly do not believe I would be really taken as asthma advocacy as far as I have if I didn't already feel the impact of telling my story. And I've seen it lots, I've heard it lots, and I keep getting invited to talk about it. So it is there. It does make a difference. So if you're sitting there wondering, well, should I do that or shouldn't I do that? Well, I can tell you right now, you should.
Yeah, I agree. And I mean, there's different levels of that storytelling too, right? Like you've put yourself out there, you spoke at events, you're doing this podcast now, which is amazing. You know, you're out there through Instagram. You've been our face team asthma for the Toronto Waterfront Marathon. Like there's that sort of like Superman involved type level, but there's other things people can, somebody might be listening or, you know, watching saying, you know, I don't have time to do this. Well, that's okay. Like there's different ways you can do it. Like I said, even just as something as simple as sending an email with our key message document attached to your local representatives, provincially or federal, just to get those messages on the agenda, share your story. Those are things that anyone could do. We're always looking for people who want to step up and do that and make their voice known. It all comes down to people, right? So whether we're talking about fundraising, we're talking about advocacy, policy change that we're trying to affect, access to medicine. If we didn't have the people behind the stories, so that politicians and other, decision makers, policy decision makers see the real human impact, it wouldn't get done. Numbers dollars speak volumes too, but it's the people, the stories behind it, the personal impact of the disease that pushes things through every time, whether we're talking about asthma, diabetes, cancer, any health condition. It's the people behind it, the patients, that really matter the most at the end of the day.
What drives you to keep pushing forward even when the work is tough? And we know that it can be tough.
It can be tough, but for me, I look at what I do. It really is a privilege to work with people like yourself and patients and families who are directly impacted by this disease. So for me, it comes down to the people, it comes down to the mission. I will tell you right now and put this out publicly. If I didn't believe in this cause, if I wasn't a donor and an advocate and somebody who's willing to stand up and put my every bit of myself behind the mission, I wouldn't do what I'm doing. So motivation's not a problem for me. It's really getting, getting the chance to do the work that I do is a true privilege, and I've always seen it that way.
What's your vision of the future of asthma care in Canada, and where do you hope we'll be in 5, 10, 15 years?
So what we'd like to see going forward and what our vision is our North Star official vision for the organization is a future without asthma. So that could be taken ultimately as, is there a cure for asthma? Yes, that's something we'd love to see. But in the meantime, let's get to the point where asthma is better controlled. And, we know that out of the 4.5 or so million people that live with asthma across the country, it's estimated that about half of them, almost half of them, actually have uncontrolled disease. So people, a lot of them not even knowing that their asthma is not clinically controlled. So we want to get to the point over the next 5 to 10 years where people understand what asthma control is, how it can be achieved, and what they can do about it themselves to advocate for their own care, so that, they're on the horizon. There will eventually be a cure for asthma, I'm sure. But in this time, in my time with the organization, in my lifetime perhaps, it's really about making sure that asthma is a disease that is readily controlled, treated, that people take seriously. We want to see fewer or no, get to the point where there are no asthma deaths, asthma directly related deaths in this country. It really does hit us every time, especially when it comes to young children, young adults, or older people for that matter, who are losing their lives because they couldn't access care. We heard a story, I think it was about 2 years ago, about an older gentleman. I think he might have been in his 70s or 80s, who lived in a rural community in, I believe it was in Newfoundland or Nova Scotia. Sorry, I can't remember the province exactly right now, but it was on the East Coast, I know. He had lived with asthma his entire life. He knew his body, he knew his disease well, realized that he had to get himself to an emergency room, showed up at the emergency room in his closest to his community, and they were closed because of health human resource shortages. So he ended up then calling an ambulance. They rushed him to the nearest, which was an hour away, something like that. Unfortunately, he passed away before they got to the hospital. So it's that kind of thing that we think is realistic to say no one should be dying from directly related asthma causes like that, where they should have access to the system. And you hear this all the time, where it's people who are even, they're doing the right things. They're taking their disease seriously, but they're not able to access the care and the education and treatment that they need, which leads to them either ultimately passing away or most cases just not living the life that they should be because of this disease. With investments in the healthcare system, having respiratory educators available to people at the primary care level, building our helpline for Asthma Canada, we have a lot of people don't realize we have a free phone and email helpline that connects people directly with certified respiratory educators. So even if you do live in a community where if you don't have a family physician or don't have access to a family health team, we can help. We need to make sure that those messages are out there so that people get the education that they need.
I'm 34 years old and I can advocate for myself, thankfully. And to kind of add a story to what you just spoke about, just a couple of weeks ago, I went to the emergency department here at my local hospital, Health Sciences North in Sudbury, Ontario. I showed up because I had been struggling with breathing for a couple of days. I had pneumonia a few weeks before, but for some reason, something was coming back and progressively getting worse after about a day or two of nonstop taking my inhalers, running out of my inhalers, which I know at this point is a no-no. I showed up at the emergency room. They triaged me and my oxygen was at a 95, 96%. And the nurse said to me, well, your stats look good. The wait time is about 8 hours. I told her, I know my lungs. I've dealt with severe asthma my entire life. And I can tell you right now that if I leave, I'm going to pass out. I don't normally come to the hospital. I'm here at the hospital today for a reason. She had told me at that point, it would probably be better for you to present yourself to a health clinic. So that's what I did. I went to my health clinic. So I am fortunate to have a family doctor. And I went there where I was able to get the medication that I needed. Unfortunately, it probably wasn't the spot that I needed to be. I really did need to be in the hospital. And it reminds me of a story when I was a kid and couldn't advocate for myself. Fortunately, I had a mother who would advocate for me. And my mother had asthma herself, so she knew what it felt like. After a couple of days struggling with asthma, I presented myself to the emergency ward. And I was essentially told that I didn't need to be there. Your oxygen is fine. Your stats are fine. Here's a prescription for prednisone, 50 milligrams of prednisone. Come back tomorrow if you still don't feel great. My mom stepped in. I remember her arguing with this doctor. Eventually, they kept me. And eventually, they would keep me at the hospital. And that evening, my stats dropped to the low 80s. And I was airlifted to sick kids in Halifax, Nova Scotia, the IWK. I spent 2 weeks in ICU, another week or two in ACU, and a good amount of time in general admissions as well. Had I not had my mom there to advocate for me, again, I was young, I couldn't advocate for myself, I probably would have went home. And what might have happened at that point, right? It could have been very bad, could have been disastrous. I could have been another fatality. Yeah. So presenting myself to the hospital just a couple of weeks ago, at the age of 34, the situation was no different. What was different is I was able to talk to them and let them know what I needed, what I'd been through. And all I really aim to see myself and what I advocate for is what we've been talking about now, Jeff, and that's having more certified respiratory educators in the emergency room. That little change right there, that little change that would give somebody a job as well, in my opinion, could be, you could incentivize it, do what you will. I don't look after policy. That little change right there could save lives. And at the very least, it could save money on the healthcare system.
Yep. That's an important point that you've just raised, in terms of that small addition can make a huge difference, right? And a lot of what we're talking about, what we're presenting to provincial governments, from time to time are relatively small investments when you think about the ultimate cost and the toll on the system that asthma has that can make a big difference. The other thing that I think you've illustrated well sharing that story is your mom and now you were your own experts and advocates. So patients are the ultimate experts on asthma. Asthma Canada has a brilliant scientific and medical advisory committee that some of the top allergists and respirologists, certified respiratory educators are part of that committee. And they're certainly experts, but patients themselves are their own best advocates and best experts because you said your asthma, right? Like, when you need to have some extra level of care. And that's something that we want to make sure that people understand. And basically what we're trying to do is empower people to give them tools and resources and knowledge so that they can advocate for themselves. So yes, we're going to continue to drive change at the system level, at the broadest levels, wherever we can, and make small changes going forward that will make a big difference. But it's also up to patients to take it upon themselves to have that vigilant attitude and arm themselves with the type of information and resources that an organization like Asthma Canada can provide for people so that when they go to the healthcare providers, if they have to go to an emergency room, they know what to ask for, they know what to expect and what they should be able to access.
You dedicated your career to helping people navigate health challenges. Is there a particular story or moment that stands out as especially meaningful to you, Jeff?
You think about it, we're changing lives in what we do. That's an incredible privilege for us. But for me, there are a number of different moments. Some of them are things that other people might not think are as significant. When it comes to sort of a big significant moment for me, I would have to say for almost a decade before coming to this role, I was with Cystic Fibrosis Canada, and I was in a number of different leadership roles throughout the time that I was there. And during the time that I was there were disease modifying drugs. The CF is a genetic disease that affects the lungs and other organs in the digestive system as well. And it up until very recently, there were only symptom management medications available. So for people living with cystic fibrosis, the average life expectancy was quite low. If you go back to the 1950s and 60s, parents who had children that were diagnosed with cystic fibrosis were basically told, there's nothing we can do, take them home, make them comfortable. And most kids at that time were living to, if they saw double-digit age, they were lucky. Fast forward to now, in the last decade, disease-modifying drugs that are actually treating cystic fibrosis became available. And what these are, cystic fibrosis is a rare disease. Drugs for rare diseases are incredibly expensive. So the big challenge that we faced as an organization and working side by side with the patient community was to try to advocate so that people could have equitable access to those medications. Easier said than done when you're talking, $200,000, $300,000 per patient per year in terms of costs. But working with the patient community, and I'm proud to say that I had some small role in helping to drive that forward into working with some of the families and patients that we worked with, where we got to the point where these drugs now are available. There are still advocacy work that CF Canada is doing because not everyone has equitable access, but working with different levels of government and with private payers, we're at the point now where most patients with cystic fibrosis do have access to disease-modifying, life-changing, life-saving drugs, which have made a huge difference. So that was, when I think about kind of those, big moments, that's certainly something that I think will always stand out for me, that I'm very proud to say that I had some role in helping to advance.
It's certainly better when you can see a change, even if you're just a little part of it. It's huge.
Absolutely.
If you could give one piece of advice to young advocates, people like me, who are deeply invested in making a change, what would it be?
I would say don't hesitate to get involved. Get involved with organizations like Asthma Canada. Look for opportunities where you can share your experiences and your voice. And sometimes that's sharing your story publicly, telling your story to various audiences or elected officials or other patients, for example. It could also be doing other types of volunteer work. We're a nonprofit charitable organization. So we rely on donations. So we have different opportunities for volunteers to get involved in fundraising to help us with events that we might be holding. We don't do a lot of events, but sometimes we have them, and getting people there to help us implement those types of events is really important. We're also always looking for ideas of how people want to get involved. Sometimes we might be thinking about doing things in a certain way that we might be missing opportunities. So there could be somebody in a community where we don't have a strong presence that might come forward and say, look, I've got this opportunity where we could reach a lot of people and change some lives here locally. Will you work with me? So reaching out to organizations like us will give people opportunities to do that. If you have an opportunity, if you're interested in, not just making a change, but maybe from a volunteer or career standpoint as well, there's always opportunities for people to get involved with boards of directors, with committees that are part of the board structures that organizations like mine have. And we're always looking for people who have different experiences, different ideas, different skills. We as a nonprofit report directly to a volunteer board of directors, and all of them have one thing in common, and that is that asthma has affected their lives in some way, whether it's themselves or through their family members, friends. I mean, asthma is a very common disease, so it's very hard to find somebody who has gone through life and not been affected by asthma in some way. But beyond that, they have certain skills. So, we have a treasurer who not surprisingly, is an accountant and has financial expertise that she brings to the table. We have board members who are experts in marketing. We have a doctor who's an allergist who's on our team as a board member as well. So there are opportunities for people from every walk of life to get involved in organizations like ours. The other thing too is because we live in this age where social media is so prominent and readily available, it's really easy to connect with others and to find ways to get involved, whether that be through, other patients. And I'm sure in the work you've done, Josh, and sharing your story and Instagram feed. Sorry, I use Instagram, but I'm certainly not a social media expert. Looking at ways to share your story or connect with people. I'm sure you've connected with all kinds of interesting and inspiring people that you would have otherwise not met had you not put yourself out there and said, hey, I have asthma, struggled with this, but here's what I'm doing to take care of myself and make sure that I'm able to live the life that I want to. And I think just by putting yourself out there, that's how we connected, right? And that's where, I think you've probably met all kinds of people who you now consider friends or have some connection with. And that's an incredibly inspiring way to do this and to make change at the end of the day.
I'll have somebody just message me on Instagram, hey, I'm thinking about running a marathon. How can I get started? I have asthma. A question like that, a simple question, might take somebody 30 seconds to send. It means so much to me. And any sort of insight that I could help them with, whether they just want to talk over Instagram, talk over the phone, or meet up at an event, it's huge, makes me feel great. And it helps them. And then it kind of lines them up with the potential to help others as well.
Yeah, absolutely.
Where can people find more information about Asthma Canada and the work that they're doing?
So we are, speaking of social media, so we're there on social media. We're not on TikTok at this point, but we are on Instagram, Facebook, Twitter /X, and LinkedIn as well. So we're happy to connect with people. You can obviously, connection could be as simple as just finding us, following us, and engaging that way. But we encourage people to reach out, to call the helpline that we have. If you go to our website, asthma.ca, you'll find all of the resources that we have available. We have webinars that are recorded on different topics. We just did one not too long ago at the beginning of flu season on vaccines and the importance of vaccines as part of good asthma management, proper asthma management. We have a plethora of different resources on all kinds of topics that are of interest to patients. You can find out more about the type of advocacy work that we're doing, what you might be able to do to get involved. And you can also, if you're experiencing any sort of challenges or if you have any sort of questions about asthma management, if you're a patient yourself, if you're a parent of a child with asthma or a caregiver, please reach out. We're always here. We're always happy to answer questions. info@asthma.ca is the general email. Our staff is really good about triaging that so that if you're looking to connect with one of us, the team, or if you're looking to connect with one of our CREs, the certified respiratory educators that we work with, we're happy to facilitate those connections. So I would say visit the website, find us on social, follow us, reach out, get involved. And I often say too, if we don't have an answer that you're looking for, we will connect you with somebody who can help.
Thanks for sharing that, Jeff. And I'll be sure to leave that information in the descriptions. That way the listeners can find it that much easier as well.
Yeah, excellent. That'll be great.
So is there anything that you would like to plug or Asthma Canada might want to plug?
So I think we've spoken a lot about our advocacy initiatives, and I think that's something that's becoming more and more important year after year in terms of, protecting the investment that we have, the stake that we have within the healthcare system. So I think I would encourage people to look for opportunities, whether it's with Asthma Canada or other opportunities, to raise your voice, to make your concerns known, to help us with the policy change that we're trying to bring forward. That would be really important. We also know asthma is, as I was saying, asthma is a disease that often kind of gets downplayed. There's still, unfortunately, and really sadly, there are still some stigma associated with it, especially when it comes to kids kids who struggle with asthma might be seen as somehow being weaker or different than other children. So we're launching a new program this year that hopefully will help kids understand their asthma and speak to their peers and to their teachers and others about it as well, so that everybody understands what asthma is and the fact that it is a disease for most people that can be managed and controlled. We also, for World Asthma Day, which is May the 6th, we're going to be launching a number of different campaign elements. Some of it will be around raising funds to support our work, but also around this whole concept of asthma control, so that people, even people who sometimes think that their asthma is well controlled, but if you start going through the questions, the simple asthma control tests, like the one we have on our website, sometimes people are surprised to, oh, you mean I shouldn't be using my rescue inhaler multiple times a day? Like, that's what I do. That's how I manage. That's how my asthma is controlled. Clinical definition says more than twice a week, your asthma is not well controlled. Things like, waking up, symptoms waking you up in the middle of the night, affecting your sleep. That's another sign that asthma is not as well controlled as it should be. So check that out. Even if you think your asthma is controlled, let's make sure that is the case. And the types of tools that we have on our website can help people understand what that means and hopefully give them something, empower them with something they can take to their doctor, to their family health team, to, whatever healthcare practitioners they're working with, to make sure that they're giving themselves the best chance to manage this disease and to live well, to live symptom-free and live well with asthma, whether someone has good control or not of their asthma. There are always things that can be done differently. Medication maybe needs to be changed, the frequency, dosage, trigger management. It's a big thing. We talked about that earlier, how sometimes unknowingly people are putting themselves at risk. They're using a wood burning stove. That may be something that is triggering their asthma and making the condition that much worse. So it's, it's things like that it's like, it's kind of, I look at it sometimes as like a puzzle, right? Like there's little pieces to it beyond the obvious things that sometimes people need to dig into. And I'll stress again, it's not, we're not saying that, somebody who is beyond those clinical control guidelines isn't doing a good job. Like, everybody, I believe, wants to manage their condition. We're just trying to open their eyes to things that could be better. And having those conversations with your healthcare practitioners, getting to the point where, like yourself, you understand that if you're burning through a rescue inhaler in 2 days, that's not good. It's like you to be, you should be going forward. Like, don't just accept that. Like, go forward, ask questions, say, what can we do different? Is there something else that we can try?
Absolutely. Thank you for being part of the podcast today, for enduring this interview with me. And being episode 3 of Beyond the Wheeze. It's great to have you. When I started this podcast, I thought of you right away. So thank you for being on. And I hope that I get the opportunity to have you on again in the future. I know that I'm going to run into you, many times over the next couple of years. And it's always a pleasure working with you.
Well, I feel the same, Josh. It's a pleasure working with you. I'm so glad that you're doing this podcast and all the other great things you're doing to really help lift and bring these messages out to wider audiences. So I'm always here. Our team's always here and happy to do this podcast. And hopefully people it'll spark some ideas for people in terms of how they might want to get involved, might want to check, to see if their asthma is potentially not well controlled or not as controlled as it could be. And, it's the last thing I'll say is just oftentimes it's like one person, one thing at a time that makes a difference. So if we can reach people and help somebody to improve their lives through this type of initiative, I'll be here anytime you need me.
So I do have one final question, Jeff, that I ask at the end of these interviews. It's a little bit of an outro that might feed some inspiration to the listeners. Whether you have asthma or not, every breath we take is a gift, a reminder of our resilience, our drive to keep going, and our power to define our own limits. With a single breath, you have the potential to move mountains and change the world. So with that in mind, I have again just one final question for you. If you had only one breath, but with it the power to influence the world, what would your message be?
My message, if I had one key last breath message, would be get involved, advocate for yourself, tell your story. It's those things that, I'm sure when you reached out with your initial work that you were doing, sharing your story, you probably didn't realize the type of small interactions and what that difference that would make. So don't look at the problem for what it is at the macro level, look at micro levels and look at opportunities to make a difference, because it's all those incremental things that ultimately will get us to where we need to be.
Thank you for listening to Beyond the Wheeze. If you enjoyed this episode, don't forget to subscribe and share. Follow us on Instagram at Beyond the Wheeze, or follow me at the Asthma Runner for more updates. Keep breathing strong, and remember, your potential has no limits. Until next time.